Thank you for watching. This video is in regards to getting discounted subsidies based on your healthcare marketplace plan through the Affordable Care Act. My name is John. I'm a licensed health insurance broker, licensed in about 35 states, been doing this for over 6.5 years. And we're going to go ahead and dive right in. This is a website, from consumer website, where you can actually get your quotes. I'll have the link in the description where you can get different verticals such as health, travel, dental, Medicare, life, and property. Property and casualty is only be in the state of Florida. So let's go ahead and begin. Request free quotes. Right here, we're going to go ahead and put in a dummy quote, 32839. And from here, we're going to hit and say see plans and price points. Right here is where you want to see the subsidies. Would you like to see if you qualify for financial assistance? Yes. And this is going to be based on what basically your taxes or something where the government can gauge how much you have been paying for, what your income threshold is. And to find your income threshold, in order to have a healthcare marketplace for individual of one person in the household, you're going to have over $12,880 for 2022 in order just to get onto the marketplace. Anything below that, you may qualify for Medicaid. For a family of two, it's going to be over 17,420, and etc. So let's go ahead and go back. Let's go ahead and do an example. We're just going to say this individual is 25, non-smoker, no spouses, no dependents. And let's just say he makes around 20, let's say 24,000, that's fine. And hit continue. We can input right here, no kids. He's making around, he'll get about a $347 discount from the government each month, meaning that he can get plans as low as $0. So we're going to go ahead and compare them side by side so you can at least kind of gauge which plans are going to have a little bit more quality in the lifestyle that you choose for a healthcare plan. Here's where you can input your doctors to make sure that they're in network with the company you choose. Same thing, which plan will pay the lowest on the prescriptions, whether brand name or generic. So go ahead and skip this section right here. And then this next section is kind of go overview section. And so you can see the discounts, everything here, household, no dependents. And we can see it's for plan 2020. Here we got 186 plans. We can see the monthly premiums here. As we start looking at different things, deductible is just the amount of money that you have to pay if you have like a scheduled surgery or if you get a hospitalization. They're going to want to require you to pay that, or they'll bill you after the fact. So if you look at it, you really kind of want to avoid things that say after deductible. You're probably going to have a little bit more of a challenge just to use the plan, meaning that you can't even really go to the doctor until after you pay the $6,100. So these plans generally are not really as user-friendly as some of the other plans that will have no deductible. So we're going to go ahead and reduce this down to 0. You can see the plans right here at 186 in the middle drop down to about a third of it, about 51 plans. And obviously for this individual, it makes 24,000. We're going to try to get this as much lower as possible. Let's go ahead and drop it down to around 78. So we've got about 35 plans to choose from. And then the next thing I really would like to look at is whether the networks, EPOs versus HMOs. And I have a little chart here. HMOs just means that you must stay within network. EPO as well, stay within network. But on an HMO, you're assigned a primary care physician. EPO, you're not. And the primary care physician, he determines whether you go to a specialist for the majority of the plans on the healthcare marketplace. Over here on an EPO, you have more freedom and flexibility to go directly to the specialist. And some plans may require prior authorization. PPO means that you won't have in a network. Well, obviously you have a network, but you go in and out of network. If you go out of network, you probably have charges a little bit more than if you went to somewhere in network. Let's go ahead and go back in here. If we start looking at it, we're going to also see over here metal types. Metal types is just basically, if you look over here, the tier levels of what your co-insurance or co-pays might be. On the stronger ones, such as platinum and gold, they'll be a little bit stronger in coverage. What you'll find is if you go with maybe like a gold, you can see the price points change here. And give it a second as it recalibrates. I guess it's going to be over the threshold that we had here. Let's go ahead and increase that. You'll probably be able to see some of them at the 95, but you're going to see some of the out-of-pocket maximums a little bit higher. If you really want to get that a little bit lower, what you want to do is probably shoot for more of a silver plan. And if you do that, you're going to see them right around the 2,000 to 2,500 to 2,900 with the zero. These are more ideal based on this. And if you look at it, so we can kind of refine it a little bit more based on EPOs and HMOs. I'll just kind of, for simplicity, I'll just keep it on the silver, and we're just going to compare and contrast a few of these up to 5, what we do. And we'll compare them right here. And that's the same company. We'll pick this one. Let's see if we got another one. All right, so we got a few plans here. What we're going to first do is compare them side by side, roughly all around the same cost, 37 to 35. No deductibles here, which is really good. Maximum out of pocket is just the most you'll ever spend in a worst case scenario for a healthcare cost, not prescriptions, just for the healthcare cost. So in this case, you, for a given physical 12 months of that year, you wouldn't pay a penny over the 2,900 on this particular plan. Now, overall rating, some of them might not have a rating. That's just because they're newer on the market. And network wise, we just discussed this here. So we got 2 EPOs, really like the EPOs better. Doctor wise, this one will be free versus 15 to 10. Specialists roughly around the same. This will be still coming out really low there. But what I really like to look at too is the emergency rooms. This one's at $750 with 30%. You got to be careful with anything that's after the deductible, because this one does. This one doesn't have after deductible, so it's only 25% after the deductible. It's really good still. 750 here on this middle one, so which will be an Oscar. I really like that one just because you're at 750 on the ER and hospital stays. If you look at the fine details of the plans right here, either click on the summary of benefits or the plan details. You can kind of scroll through it. Right here will be the summary of benefits. You can kind of dive in what's not covered. Generally, you can look at here. Prescriptions, all the preventative is covered, and you can see that towards the bottom. Brand name drugs will be out on 75. If you can choose, try to go generics if possible. If not, then you can still get the brand names, but it's just going to be much more. And if you look at the lab works, you can see it here in the price points, and in the ER visits. Mental health will be covered. All pre-existings will be covered on the Affordable Care Act. If you choose to go like a privatized health, they usually have pre-existing clauses where if you've had a prior pre-existing, it wouldn't be covered on a privatized plan. Usually you want to get a subsidy on those. And for preventative here, if you look at the different ones, a lot of this is covered here. The COVID-19 vaccinations are covered on usually Medicare, but not on the Affordable Care Act. So you can probably try to look around, maybe call somewhere locally. You might even get that at free of charge at one of your local clinics in your area. But based on that, let's go ahead and dive right in. What is not covered on an Affordable Care Act plan? And to save time, I'm just going to quickly do this. And we're going to jump right in and blow this up. And we can see here, a lot of people don't know that if you go to something that needs immediate attention, you can see right here, if you go out of network, it will be the same as if you go in network, but it's got to be deemed as an emergency in order to do something like a emergency transportation, emergency room. You can see that that is covered. If we go all the way down to the bottom on this particular plan, we can see what the plan generally does not cover. This is obviously not a dental plan. This is not hearing aids, no eye exams with this one with vision. You can get an optometrist, but not optometrist is not covered, but ophthalmologist will be covered. So not a weight loss program, but you would get stuff like such as a chiropractor visits on this one. Usually most of the plans will have about 12 per year on that one. Just make sure that they stay in network. If you need help applying or need assistance or have any questions, just let me know. You can reach me through the link below or just give me a call. I'll be glad to help you. Take it easy.